Hey, good afternoon and welcome to this discussion, which is the first time that we're going to have two pharmacists in one discussion talking to me. And even more exciting, a pharmacist dad and a pharmacist daughter combination from California, sunny California. So it's awesome. Really my privilege to be talking to John and Pearl. John, who I'll be referring to as Sketches, because that's how I know him from many, many, many years when we were in school together. And lovely, lovely Pearl, who is a Pharm D, and I can't wait to hear all about her own experience. But today, that's who we'll be talking to, and they will share a lot of their experience and expertise for the benefit of young pharmacy students, young pharmacy graduates in University of Nigeria or anywhere else who can be inspired from knowledge of how pharmacy is practiced across the world, especially in the United States. Some people may be interested in emigrating and working in the US. Some people may just want to learn best practices from others and incorporate it into what they're doing right there in Nigeria. However, this information can benefit anyone. That's why we're doing it. So John and Pearl, thank you very much for spending a part of your weekend talking to me. I really appreciate it.
No problem. Very excited to be on.
Thank you, Ebere. Very excited as well.
Great. So I'm going to first turn to Sketches, John, and ask if you would, first of all, tell us about who you are and where you're coming from, so people will know a little more about you.
Yeah, thank you very much, Ebere. Like you said, my name is John Okonkwo. Back in the school days, they know me as Sketches. I graduated from University of Nigeria in Nsukka, and that was way back in 1985. So that's many, many years of post-experience right now. So you realize that by the time I start going into more details, there are a lot of wealth of experience. I started with an internship, right after graduation at the famous University of Nigeria Teaching Hospital, Enugu, which I will tell you that was the first, test of, what we got out of UNN, because I did recall that there were over 50, pharmacy graduates that came for that interview. It was a 3-day interview, and at the end of it, there were only about 6 of us that made it. And I was lucky to be one of those that, got into UNTH Enugu, along with my other friends, Moses says the one, Juchukuka, we are, we're all there, Odo, so even if so we were just lucky to just be the 6 out of, and I tell you, it was a very competitive interview because I knew they were actually testing our knowledge. So that was the first time I knew that, yes, I can pride myself as being a UNN graduate of pharmacy school, because I knew what I learned was able to help me. So going forward, after the internship was the youth service. Again, I wouldn't say I was disappointed with where I was posted, because usually when you school in the East, you're looking forward to a different region for your youth service. Fortunately, unfortunately, when the posting came out, I was posted to Owerri, Imo State. I said, okay, well, Anambra State, Imo State, that's okay. So went on the youth service. After the orientation course, I was posted to College of Technology, Naked Owerri. And when I got there, I realized that the school had no pharmacy department at all. It was just a small clinic they were running, with the chief medical director. So, I approached them. I said, I know I can run a pharmacy department. I can run a clinic, a pharmacy clinic, I just need a little budget, let's have a meeting. Let me see what kind of medications because all they were doing were just injectable. So I ended up being a youth corporate that set up a pharmacy department, in that college. So again, I prided myself as something that, was very contributory to the school. So after the internship, and the youth service, it was now time for where do you want to work? Meanwhile, while at school and also during my internship, I realized that I had a flair for medical representative because I see these guys, they come in with their cars and big bags and samples. I'm like, okay, this is the kind of job I want to do, you know? So I was always looking forward to that, you know? And I didn't get it right away, but every newspaper in the country, I was buying, I was looking for where to apply. People would say, oh, you don't even get anything on newspaper. Before they didn't publish it, they already, you know, got someone through the back door. But I never gave up. So I kept on applying. While I was doing that, I had a little pharmacy I was managing way back in Port Harcourt, you know, Rivers State, Nigeria, you know, just an independent pharmacy. So I was there one of the days, you know, I got a call from my brother-in-law who is in Lagos and said, there's a letter of interview here for me. And I was getting this call at about 4 p.m. today. An interview was supposed to be next morning, 8 a.m. So I was told, you know, I need to be, you know, be in Lagos. So I was thinking, oh, maybe it's one of these, because, you know, it's funny in Nigeria, you don't even know who you're applying to. They don't disclose. So I was thinking maybe it's just one of these one-man business again. But the moment I was told, make sure you come with your your passport. I said, maybe this is one of the multinationals. Now, whatever it's going to take, I have to make a means to go. So I couldn't get a flight right away. So I had to use a night bus to travel to Lagos that morning. Got there that morning, got to the interview. I got there even late. They said, oh, we're ready. Again, it was so many people for the interview. I remember seeing Ike at that interview, you know? So it was so many people. They said, oh, we're already done for it. I said, please, if I tell you my history, what I went through to be here, just put me in there. Just give me a chance, you know, just give me a chance. So finally they said, well, we're done with the interview this morning. You can go on lunch, but if you still feel like you want to be interviewed, you can come back after lunch. You know, I wasn't interviewed before the break time. So I told myself, I said, I'm going back, you know. So I went, I had lunch, I came back for the interview. For that day. You know, after I was interviewed, I was asked to come back the next day. So they were actually shortlisted. So I got shortlisted. And then the next day we were about now maybe 12 people, you know. We had interview again, they shortlisted. Next day was 8 of us. We shortlisted again, then not the final 4. So again, that was how I got that job, you know, and it was a SmithKline Beecher, you know, also a multinational company. So I took that job, you know, the next thing they flew us out of Nigeria to Egypt for training. And that's how my career started. I did so well as a medical rep, you know, within 2 years, I got promoted to an area manager. In fact, when I was being asked to be promoted, I said, no, I don't want to be a manager. I love it in the field. I just want to be doing this, you know. But my boss said, you know, you deserve it because you have the track record to move to the next level. So I got promoted to an area manager and sent over to the north. Okay, and while in the north, it was a very big area for me. I was learning on the job. I was doing everything I can. And before I know it, they say, okay, they want to merge Lagos and West. They're moving me back to Lagos. So that's how within 3 years of my stay with SmithKline and French, I'd just gotten so much, you know, exposed and experienced that they were not putting things on me. It's like, oh, you know, secondment and all those. I said, hey, you guys take it easy on me, you know. I'm still young on this, you know, but I was just lucky I had a boss who so believed in me and was always giving me that opportunity every time, you know, one comes up. And that has been my, you know, my team with the pharmacy profession. I've always, you know, had it, you know, where I'm challenged, I'm exposed, and I can impact, and the results are there, you know. And I'm sure there'll still be time for me to talk more on this, but you know, I have really been so blessed, you know, when I chose this pharmacy profession. It's still more to come. So I'll just take a pause here.
Yeah.
Exciting. So was it after SmithKline that you came to the US, or did you spend more time in Nigeria before you came to?
I spent more time in after there are mergers. After 3 years with SmithKline and French, they merged with PhD. And then it became SmithKline PhD. And that was, in fact, let me be more specific. So I started with the SmithKline and French in 1988. And then by 1990, they merged with PhD, and that became the SmithKline PhD. They did all their merger and all those integration thing. I was even thinking, because PhD was so big then, we SmithKline and French was just a smaller company. So some of us were thinking that we'll have no place in PhD. But again, see what it is that they pool resources and then they did whatever they did. I joined, I became part of the SmithKline PhD. So yeah, so that was when, they got me back from North and brought me down to Lagos to manage, Lagos and West. And I had that job for the longest manager in that position, because people say, oh, no manager has stayed in this office for more than 2 years. I was there until I became the regional manager again with SmithKline and PhD. And that was up to 1992. That was when I became, the regional manager. So that position I held until 1998, when I started to relocate to the US.
Fantastic.
Yeah.
Well, that's certainly very interesting to have hospital pharmacy background, pharmaceutical sales background in a multinational. So no wonder you have a wealth of experience, and your excitement about pharmacy, maybe we'll find out from Pearl, contributed to her interest in the profession. So Pearl, if I can turn to you, you look so young to me, and I was thinking you just graduated maybe last year, but why don't you tell us when you graduated and a little bit about what you've done, even, just a little bit about your own journey.
Sure, yeah. But you were definitely right. It is my dad's excitement that got me interested in pharmacy. He lights up when he talks about it. And since we've been in the US, he's been a pharmacist like the entire time since I was born. So I got to kind of see the back end when a pharmacist comes home and what they do and how they talk about it. So that definitely piqued my interest. But it started with undergrad, which I went to Cal State Fullerton. They didn't have a pharmaceuticals major per se, but I chose biochemistry. So had a lot of science, a lot of biology. Even when I was younger, that's always been topics that interest me in school. So it made sense that I chose that major. And then once I finished my undergrad, while I was actually as an undergrad student, I worked as a pharm tech at Rite Aid. Funny enough, it was the Rite Aid right across the street from my dad's Rite Aid.
but your dad wasn't your boss.
He wasn't my boss. No, they wouldn't allow it. Even though I remember begging, like, it would be so great. But some days we would eat lunch together. So it was definitely a good experience to be, calling over like, Dad, do you guys have this in stock? Or do you have this in stock? Definitely a fun experience. So I was a pharm tech for, I think 3 years or so. Yeah, while I was in undergrad. So I definitely got that experience. And I think as a student in the US, that's usually the projection that kind of goes. You start as a pharm tech or a clerk just to get some of that exposure. Usually as a clerk, because it doesn't really require any licensing or anything. You just kind of apply to the job. And then depending on the company you work for, they can set you up to get your tech license, or you can do what I did and just do some like online programming and take the test, which I recommend too, because I know some schools will offer the schooling, or, there's multiple pathways to get to that licensure. But once you get that, then you work as a tech and then obviously going to school. So I did that for a couple of years. And then when I relocated to New York, I actually worked as a clinic manager, which kind of gave me a little bit of my leadership background too, because starting off as a tech and then going into a manager position, I was more in charge of like operational stuff, doing billing and things like that. So it kind of gave me the acumen to kind of know some of the background outside of the clinical things that I knew as a technician. After I did that for a couple of years, I decided it was time for me to go to pharmacy school, just to kind of put them together, be able to understand the business aspect as well as the things that I'm interested in, which is like the science of it. So I applied to several schools, some in New York, some in like all over them. I did get into most of them, but I chose Chapman because it was 10 minutes away from home. I would get to move back, and having a father as a pharmacist is definitely an advantage, especially if you're going into pharmacy school, because it's like a private tutor, a mentor, all in one. That was definitely a big decision for choosing Chapman University. And then while I was in school, it was definitely, hit the road running right from then. I was involved with a lot of leadership programs. I was actually president of the American Pharmacists Association, the student chapter, which was really exciting. I think I was the president for 2 years. And then I'm also a COVID graduate too. So half my last year of pharmacy school was entirely online, partly because COVID had shut down the in-person education for a lot of campuses. And so the program I actually went to, Chapman, is a 3-year accelerated program. So all through, January to December, you're in school. So you'll do clinical didactic work, which is in the classroom, reading and programming for 2 years. And then the very last year will be strictly rotational. So you'll be on the field working in different settings, depending on how you set your schedule. And then after that third year, you graduate. So that second year of school for me was entirely online because that was 2020. I started school in 2018. And so by the time I graduated, I had several experiences. I got to work in a hospice pharmacy. I did 3 blocks or 3 clinical rounds at UCLA Harbor, which is a teaching hospital located in Torrance. Very great experience. I got to do a lot of infectious disease work. So I was a part of the antibiotic stewardship, which I can elaborate later on if we get to it. But a lot of my exposure on my rotations was primarily antibiotic stewardship, as well as doing like hospice care and even community rotations. While I was in school, I also worked at CVS, which is what allowed me to get my job, which is where I currently work as a pharmacist right now. So it's definitely while I was in school, I had different pathways to choose either residency or clinical, or to choose like community or some non-traditional, but I went with community or retail pharmacy because my dad is one. I'm kind of more familiar with it. My background is in it, and it kind of fits my personality. I love talking to people. I love the patient interaction. So yeah, that's my brief story. Just kind of get started. So hopefully in a couple of years, I'll have some accolades that I can give like my dad does.
Well, I think you already have a lot of accolades. I'm sure your dad and your family are very proud of you because you spent 4 years to get your undergrad, your bachelor's in biochemistry, and then you went back to school, to pharmacy school for 3 years.
Yes, I skipped. I also got my master's while I was in New York.
Oh my goodness. Yeah. Wow. So your master's in what area?
It's in molecular cell biology.
Wow. Yeah. See, you already have a lot of accolades. And your pharmacy degree is a Pharm D. Is that correct? Mm-hmm. Fantastic. Congratulations. And I wanted to comment on, and I know it's not atypical, but I think it's still impressive, how much undergraduate students, you have your school workload, and you were still a pharmacy technician. So that balancing act, and then the president of the Pharmacy Students Association, your leadership, that's not a small feat.
Thank you.
So that's really impressive.
Yes.
So, John, I'm sure you agree with me.
Yeah, totally. I mean, I was even trying to, it's like cut out certain things. I say, hey, your school is the primary thing, but she said that I can do it. I can do it. I said, if you can, then I believe you can. So go for it. Yeah. I remember when she was wanting to run for the president of the student chapter of the APhA, you know, I said, yeah, go for it, you know, stand up, speak out, you know, you're more than qualified, you know, and there you go. She went and she, you know, she was elected. So, you know, she's a mover.
Yes, great, great. So, John, having observed, because as Pearl was talking, you know, all the rotations you did, I was in my head contrasting our training and the training pharmacists have these days.
Yeah.
I don't know to what degree it's global. So this is what American pharmacy school curriculum entails.
Yeah.
There's a lot of clinical rotation. And leading up to the Pharm D degree, in your case, you have added a master's degree to it. And either one of you, maybe starting with John, how do you appreciate the difference between their training and our training? And in the work environment, are there any gaps for those of us who don't have a Pharm D? Or if Pearl, if you're speaking to it, how do you maximize your clinical background in the workplace? Just to give those who may not have a Pharm D an appreciation for the pros and the cons, because obviously your dad without a Pharm D is a very successful pharmacist, so it's not a requirement, but give us an appreciation for the difference it makes.
Right.
John, do you want to start?
Okay, yeah, I will start. Yeah, I'll definitely. Let me just start by saying that first of all, when I relocated to the United States, the very first thing that I was required to do was to have my credentials evaluated. And I do know that some people, because I did my homework before I came, there have been some other pharmacy graduates from other schools, and depending on your school and your curriculum, sometimes when they do the evaluation, you are required to go make up some more credits, you know, or something is deficient. But I was so impressed that when they did my evaluation, my credentials from UNN, everything was okay. I was not required to go do any other additional thing. You know, I was like, okay, so now, you know, because I have to go through the FPGs, you know, the Foreign Pharmacy Graduate, you know, Committee. So I was, you know, eligible to take my exams. So there and then is an indication that as at the time we graduated from UNN, the curriculum they had at UNN was worldwide standard. I mean, in US, I had nothing else to add to that. Some people that went to University of Benin, they had to add something, maybe whatever it is, you know. So that is one part that showed me that what I had then was complete. I didn't think I needed to go do any other thing. So I sat for the board, you know, I passed my exam, I started practicing. So coming to the kind of training that we had, yes, the Pharm D obviously had more clinical component than maybe what we did. All right, I know with the Bachelor of Pharmacy, okay, we spend time on the traditional, you know, pharmacological classes, but, you know, with the Pharm D, you can see there are more emphasis on clinical components, you know. I mean, interdisciplinary, you know, collaboration with other departments, medicine, you know, so there is more, I would say definitely, you know, with the Pharm D. But however, when it comes to community pharmacy, you know, where, you know, you have to, you know, be very, very knowledgeable about the drugs that you are dispensing, you know, in terms of the safety, you know, the adverse reactions and all those things. As a Bachelor of Pharmacy, you are well equipped. As long as you're keeping abreast of what is happening as well, you know, continuing education, you are well versed, you know. But definitely there is that added advantage if you had a Pharm D, you know, especially if you're in a hospital setting, you know, that's where I would say more benefit comes in, you know. That's, you know, that's one take I would see between, you know, just what we had as a training and what Pearl had as a training. Pearl can add to that.
Well,
So even for, I think what was kind of unique to my path is while I was a pharm tech, it was before a lot of some of the changes that happened in like the current pharmacy setting, like with the development. Now there's like advanced practice pharmacists, or even some jobs requiring Pharm D versus like just like a regular being an RPH. So I definitely think that like my dad says, it's more so the training that you get on the job, whether it's Pharm D or B Pharm, whichever one it is, like you always having to keep a breath and do your continuing education. You're well equipped to be a pharmacist. But one thing that definitely kind of set it apart with our as a Pharm D is they really emphasize the I guess the pathway to go into being a clinical pharmacist. Even more so once you graduate, they like for students to do residency. They're trying to make the Pharm D aspect become more clinical as opposed to like community pharmacists. So a lot of our training was to do be in the hospital, working with the doctors and doing like therapeutic drug monitoring, things that you really only do in the hospital setting. And so I think our training did equip us for that. Whereas if you're in a community pharmacy, you're still equipped to do that as a Pharm D, but you have that just a little bit of more specific training while you're in school, as opposed to getting the job and doing it while you're there. And I think it's a minor, I wouldn't even call it a advantage or anything. It's just a different approach to the same goal. So I definitely think that that's, I don't know if there's a benefit per se. It's just more of the like updated version of how they're doing the schooling right now. But in my experience, a lot of the pharmacists that I work with in the community setting are RPHs, and I do find them very knowledgeable, partly because being able to keep up with how quickly the profession is changing definitely gives them an advantage to be able, they're like mentors, they're very knowledgeable, and they know things and are able to be a little bit more detailed about the drug aspect, as opposed to my training kind of makes me more equipped to do like diagnosing and maybe level monitoring. But when it comes to like pharmaceutical knowledge, I do feel like maybe as Pharm Ds we're not quite at that level yet, because we just didn't have that time to focus, and our focus was a little bit diverted to more clinical settings. But that's the only kind of difference that I see when I talk to some of my colleagues, with the difference in our education a little bit.
Thank you. Yeah, I'll actually also add, when I arrived the US myself, I chose to go to graduate school, but I missed the application deadline vis-a-vis when to take the exam, the GRE exam that you're required to take before graduate school. So I applied to grad school without submitting a GRE score.
Mm-hmm.
So they invited me for an interview. I was already in the US. I didn't know that pharmacy schools here don't write a thesis, which, as John knows, we all did based on our project. So I asked for my thesis to be sent from home in Nigeria. When it was brought, the mailing system, it wasn't going to arrive to where I was staying on time for me to take it to my interview. So I had them send it straight to Purdue University, was where I applied. And they received it before I came for the interview. So they had the opportunity to read my thesis. And it was on the basis of my UNN thesis, but without a GRE score, that I got admission and a scholarship, because they told me that my thesis indicated that our curriculum in UNN, in their opinion, was actually superior to the undergraduate curriculum of Purdue at that time. So it's, buttresses what you're saying, that we received a good education, and that has served us well in whatever track we followed.
Exactly. Yeah.
So John, may I ask you, because I know that California is one of those few states in the US that has its own unique path to registration. If I'm wrong, please correct me. Yeah. Can you describe that process, especially for a foreign trained pharmacist? How does a foreign trained pharmacist get registered or get licensed in California?
Okay, like I said, the very first thing will be to, like I said, have your credentials evaluated. I think there's they call the International Education IEF. That's what they're called. So you send your credentials to them, and then they have that evaluated. Then when that is evaluated, you now apply to the National Board of Pharmacy, the Foreign Pharmacy Graduate Examination Committee. There's a committee that evaluates all foreign pharmacist graduates, evaluate and look at what they have, And when that is done and when everything is in line, meets the standard, then they will issue you an authorization to test, which would be the exam, everybody takes, the foreign pharmacy graduate exam, This exam is only done once a year. So I remember I came in 1998. When I came in September, the exam was in November. So I had just like 2 months.
You took it after 2 months?
Yeah, I took it after 2 months, yeah.
Wow. That's brave.
I remember I was telling my wife, I said, look, I don't want to do anything. I said, how much do I need to come into the US before I can, at least survive, before I can start looking for work? I said, we can't come in more than $10,000. I said, okay. So I was able, that's all I had on me, So I did that so that to make sure that I did nothing else but just study. And, back in Nigeria, when I became a manager, I kind of left, the nitty-gritty of pharmacy. I was now in management. Everything I'm talking about, targets and quotas, and so I was just like almost leaving the pharmacy, which I said, look, I don't like this thing because as a medical rep, other reps are kind of scared of me because I know about your medications and I'm looking for the side effects, the weaknesses of your medication. Try to juxtapose my own strengths on those ones, So I was really giving myself good preparation as a medical rep, but as a manager, I was leaving those things on the background, So I found out I had to, I started reading, like from morning, I lived in the library from morning till night, because I told myself, if I don't make it, I have to wait another whole year, So it was like do or die. And I told myself, I hadn't even resigned from Nigeria yet. So I was like, if I don't make it, I told myself, I'm going back to Nigeria because I don't know what I'm going to be doing for 1 year. So, but God was on our side. So I took the test, and I think it was 75 to pass and I got 80. I said, I'm okay with the 80. I don't even know more than that, So you pass, once you pass that test, now you cannot apply to, the State Board of Pharmacy for an intern license because you're still required to, have your intern experience. They don't care, if you've been a pharmacist for how many years, So having passed that test, I applied to California board and then obtained the intern license. The other issue now is where you're going to intern because I hadn't had a job there. So, but while at the exam, we had all these companies, Rite Aid was there, Walgreens was there, passing out their cards, the recruiters say, hey, if you make it, give me a call, blah, that kind of thing. So, so I quickly called the Rite Aid guy that I had. I say, I passed, I have my intern license, I need a job, So they had to, apply for the HB1 visa for me. That's a work permit because I didn't have, all I had was a visiting visa. So they now applied, for the work permit, and it came out. So that's how I got my job with Rite Aid. So to kind of have it as a bullet point. So you do your evaluation, take your test. Oh, in fact, outside the outside the equivalency exam, you also have to take the test of English as a foreign language, the TOEFL. Okay, and that is one area that holds a lot of us because with this people try to, speak like Americans, and then they are not even hearing you, that kind of thing. So you be as natural as you can, so you have to pass that test. So passing that test and then also passing your equivalency exam puts you in a position to now apply to your state. So I got those 2 tests, applied to California, got my intern license. Rite did my work permit for me, and that's how I started with Rite. Of course, Rite wanted to send me to a hard to staff area, because we were living in Los Angeles then, but they said, "Oh, we'll have a position for you in Blight." One
what?
Where, I told her, I said, I don't care anyway. I just need to. I said, I have a family. I need to start my profession. So
I remember.
Yeah. So Blight was just a one street, So I went there. I mean, everything was okay. Everything was there. I don't see why people. Just that it's a hot, it's in the desert, and nobody wants. Nobody wants to go to the desert. So, but I was there. I had a 3-year contract with them. So I went there. They didn't pay me a bonus. So I was making money. So there was nothing wrong with going over there. In my mind, I said, this place people think is a no-go area is better than even the best place in Nigeria for me. So it was okay with me to go over there,
Yes.
So, yeah. So that was where I did my internship. You are required in California, you're required to have a 1,500 intern hours before they allow you to test. But the moment you hit 1,000, you can test. But they will not give you the license until you hit the 1,500. So the moment I got the 1,000 hours, I also applied to sit for the board, the NAPLEX, which I did, Again, God always faithful, passed the NAPLEX, and then you also have to take your law exam. Every state, there are 50 states in the United States, so every state is different with their own laws. So you also have to sit for your state exam. California, of all the states, I'll say California has a very different, unique pathway. Their state exam is almost like more than clinical exam, Sometimes people, it's easy for you to pass the NAPLEX, but you might not pass the state exam, the MPJE. So, once you're able to scale the 2, then, you're a free person. So, yeah, that is the pathway for California, as different from most other states.
Thank you. Obviously, hearing you, listening to you and Pearl, one might be tempted to think that it's easy, but I know it's not. And I know that a lot of perseverance has gone into your achievements, and also being strategic in your choices. So when you said that they sent you to a hard to post, some people may think that they should be choosy, but you seized the opportunity and made the most of it. And even, as you said, God paid a bonus. So I think that's the kind of value it's always good for us to share. And I imagine that Pearl observed and heard while growing up to see that hard work pays off.
Yes, exactly.
In your case, Pearl, having graduated from a pharmacy school here, when did you have to do get your intern hours? How does that work for those who graduated from here?
So so for most schools, I believe, once you apply and you get accepted, one of the first things they have you do is apply for your intern license. So as soon as I started pharmacy school, I was already an intern. School with your acceptance to the school, that's what's sent to the Board of Pharmacy, so that they can grant you that internship license. Even some schools, if you're unable to clear that for whatever reason, you're not allowed to continue school because it's mandatory to be an intern to be in pharmacy school. So that's one of the first things that we had to do. And then to get into the testing, that last year of pharmacy school, when you're doing your rotations and everything, those are the 1,500 hours that you're needed to complete. I think you'll even complete more than that because it'll be a whole year of working 40 hours a week that I think it's like 2,000 hours that you probably complete. So I got to do that. And then as soon as I graduated, a lot of companies will actually start to send out that they're hiring maybe a couple months before you graduate, just so that you can kind of get yourself in track, and you can even apply for your residencies. So I did that for, I think, starting January to May was application season. A lot of companies, if you're already working there as an intern, they'll select you to hire on, but it's all conditional to if you pass your test. And a lot of them will kind of put a time on when they want you to pass your test by. So they know that we graduate by May, and they'll say, within 90 days of graduating, we want you to be fully licensed. So that was the game for me, kind of similar to what my dad did. Within like 2 months, I graduated in May. And I think I took some time to congratulate myself for a hard work 3 years. And then starting in June, or maybe even through July, I started studying because my NAPLEX day was like the end of August. And I was like, okay, I have to, same thing for me. I was offered a conditional acceptance by CVS, and they said, if you're fully licensed, you'll have a job, but they won't necessarily not hire you, but you may not have any hours by the time you're selected. So I was definitely a little bit nervous, because it was like, if I don't pass this, I think you have to wait a certain amount of months too before you can retest. So I was trying to make my first time my only time, and by the grace of God,
and keep the track record of the family.
Exactly. So it was definitely, I think I took my NAPLEX on like April 25th or something like that. And then my law exam, or the CPJE, the California test, 6 days afterwards, which most people, they don't really recommend either. But same like my dad, he would remember, we would study together. He'd wake up in the morning, see me at the computer, come home, see me at the computer. It was definitely studying from sunrise to sunset. And I think it paid off, definitely. I was able to pass both with good scores. And then it led me to be able to keep my hiring at CVS. So definitely the good thing about if you're doing a pharmacy school in the US, they kind of make the pathway to being fully registered a lot more easier. They'll take care of you. They'll send you all the documents. They even collect all the paperwork and send it to the Board of Pharmacy for you, as long as you just kind of give them the paperwork to do so. It was definitely good to have their guidance in it, because I'm sure for some foreign graduates trying to figure out, especially with contacting the Board of Pharmacy, they don't always respond. It's kind of hard to get in contact with them. So having our school be able to help us with that was definitely a blessing.
Great. So post-graduation, from what both of you have said, there's a lot of continuing education, not just required, but valuable. So how do you keep up? And specifically, when COVID came about, it was new to the medical profession, the pharmacy profession. Either using that as an example or any other example, how do you keep your knowledge fresh? And either one of you can go first.
Yeah.
Okay, I'll go. Continuing education is a necessity. If you want to remain in the profession. So there's no two way about it. The question is, what program do you have? Luckily for me at Rite Aid, which is where I've been all this while, they have enrolled us in the pharmacist letter, which is one of the accredited schools of continuing education. So so you have an organizer there. In fact, somebody like me, I have 4 other licenses. I'm licensed in Nevada, Oregon, and Arizona. So I have these 4 licenses. So
you overachiever.
I was doing this because, now we have, at the time we were here, there was a lot of manpower shortage, So I had been flown to Nevada to go cover a shift, I was just flying everywhere. So the more license you have, the more you're available, your resource, so, and all it required was just, transfer your scores and just take the state exam, law exam. So like I said, I was always looking for one exam to take, So that's how I ended up with 4 licenses. So when it comes to CE, so the pharmacist letter, there's an organizer there. So they have all your licenses, and every time you do a CE, it gets reported into, it have your NADPE file, it gets reported into that, So it's a question of you make out time, it's just an hour thing. Most times you can do it under 45 minutes, and they give you things that are current, the way I like pharmacy letter is things that are current, questions you get from your patients, what are they saying about this medication? So it's like you reading, educating yourself, and at the end of the day, it takes a few questions and answer them. So it's very knowledgeable. It keeps you abreast of what is happening. And I said, now, like I said, it tracks your record. So it's not like you are keeping receipts here and there, In California, they don't ask you when you do to renew your license, you have to attest to the fact that you have, done the required 30 credit units. Most times they don't, declassify. It's like any 30 is okay. Some will say, okay, out of the 30, they want 2 hours to be law exam, law CE. So that at least you're also keeping abreast of the law CE, And for someone like me who's in the management, I really need to know what the law is saying, So every time something is new, I need to know. So I even do more than the 2 hours in law just to make sure that I'm very much conversant with what is happening. So that's how we do that. Like I said, you're educating yourself, and then you also already, anytime you get called upon, because they can ask you, audit. They can say, hey, okay, last year you renewed. Can we see your certificates or your record? So you just go into pharmacist letter, you just print it out, You don't have to keep the receipts yourself. Everything is in there for you. So that takes care of, being able to, meet your requirements in CE, and then you're able to renew your license, when it's due. And again, the importance with CE is, like I said, pharmacy is changing, all the time is changing, Now, are we talking about clinical, programs, immunization, medication therapy management? Pharmacy has gradually moved from counting and pouring, which is what your technicians do for you now. You are now primarily engaged with clinical, program, talking with your patients, They want to, because sometimes, in fact, when they do a survey, the patients think you don't have time for them, So the moment you spend even 1 more minute with a patient, they appreciate that. So the pharmacy is gradually moving towards, taking away the routines from the pharmacist and giving him the time to actually be patient focused, dealing with the patient one-on-one. And like I said, immunization. In fact, if you come to my city now, some people will not want to get their shots except it's the shift that I'm working. They're asking when is John working, because that's when I want to come and, I don't remember doing anything special about giving shot, but for some reason, somehow, the skill and everything is like, that's the only person they want to get a shot from, So this, and it gives you that joy that, you have a relationship with your patients, So yeah, pharmacy is moving really fast, giving us that interaction with our patients,
Good. So Pearl, do you do anything?
Yeah, since I'm new, so most of even since I graduated, the couple of new drugs that came out, like the approved ones for COVID, since I technically don't have to do any hours yet because my license is still fresh, a lot of my continuing education is like informal and on the spot. if a patient comes and asks me a question, I'm like, oh, okay, I don't know this yet. I'll write it down, look it up so that I'm like adding to my knowledge as I go. But most of what to keep up, I also have the Pharmacy Times magazine that kind of gets shipped to our pharmacy. So during my lunchtime, I'll read through it. Even having dialogue with some of our friends, just if they know anything or saw anything new, we share. Also, since I'm young, I have the advantage of like technology too. I'm on a couple of Reddit pages where it's pharmacists from all over different states. If they learn something, there's like a topic of the day where everyone shares like, what did you learn today in pharmacy world? And so I kind of just go through that to keep abreast with the different things. And it's good. Some people will teach you skills that you may not know, especially if they work at CVS, or someone may elaborate on something or, challenge a thought that you have. So right now it's more so just having conversations with my colleagues, doing some reading on my own, and then also doing the continuing education on pharmacist letter, like my dad was saying, to keep track of my hours or when I do have to renew my license.
You mentioned a very relevant point for people who are based all over the world, like Reddit, which I know from my own children is a source of all sorts of information. About a month ago, I spoke to pharmacy students at UNN, and I told them my fascination for online learning. So can you share a little more about this forum on Reddit or any other, just the kinds of tools someone based in Nigeria may be able to use, even from Nigeria, to keep abreast of pharmacy knowledge?
Yeah, actually Reddit it's great because it's basically just a forum of any and multiple interests, whatever you could be into. It's either if it's sports or television, it's basically just a website where you can type in your interest and different groups will pop up related to that. So what I did while I was in school was I put in pharmacy so that anything related to pharmacy I was following. I also followed CVS because that's the company that I work for. So there's even a CVS Reddit. And on those pages, it's free for everyone to just post and share information and kind of just chat. It's not video or anything, it's just purely typing. And some of them have moderators where they will kind of guide the discussion and keep it kind of organized, so you're not kind of just fielding through a bunch of different information. So a lot of times for me, if I'm on my lunch break or something and I just want something to kind of read to pass the time, I'll go to like the pharmacy topic of the day, where some people have posted like, oh, this is some news that came out, or this is like an update on a study that came out about this drug, or just, something to kind of pass the time. And it's more casual. It's not like reading through a whole chapter or something like that. You kind of get the quick information to be able to have a conversation about. And so I love it. I think for someone who is maybe in Nigeria thinking of coming, I'm sure that there's a TOEFL or foreign graduates even page that they can look on Reddit. And it's even when I was studying for the NAPLEX, people would even post their study guides on there, notes or Quizlets. So it's definitely a great way to meet other people that are going through the same thing or into the same thing, and just sharing information. And it's free, it's on the internet, it's accessible all over the world. So you never know who you're talking to. So I definitely encourage, if anyone is interested or has read it already, to follow some of the pages. I don't know if there's even like international ones, but I'm sure that there are. Sometimes I've actually looked into if I had thoughts of maybe moving to London and what that process would be like if I wanted to go from US to another country. And so I did do some reading and saw that it's actually kind of difficult and maybe not a good idea. So it was through Reddit that I was able to get more information on what that process is like. So I definitely, I encourage Reddit a lot.
Yeah, we at some point moved to China, my family. And before we moved to China, it wasn't Reddit, but I went online and I was in a group with Americans in China, foreigners in China, Black women in China.
Yes.
Just learning from the experience to prepare myself for any challenges that I might encounter. So I'm glad you brought this up because I think it's very useful.
Yes, yeah. And there's even more things too. I know there's like pharmacy student network where if they're in school here, that's what I was using when we were in school because it's mostly just pharmacy students in the US. And then there's even like Facebook groups too that have, just networking is even LinkedIn. It's definitely a key component to a lot of aspects in pharmacy, getting jobs, staying in the loop, applying for leadership positions. So yeah, it's definitely a great thing.
Great. So John, please, I'd like to give you the opportunity to offer any guidance or advice to these young folks. I feel like your path is very inspirational. So if you're talking to them, how would you advise them what should they be doing now to maximize their success? And it doesn't even matter whether they are planning to be in America, even if they're practicing pharmacy in Nigeria or somewhere else in the world, what words of wisdom would you give them?
Well, first of all, what I'll tell them is that anywhere, I still think pharmacy is a very noble profession. So they are on a good path, So what is important is to put in all your effort. There has to be some element of hard work in that. Commitment is there, it's not something, one leg in, one leg out, So you have to be so body and mind all into it. At this level, when they are training, they need to acquire the necessary knowledge, and the skills as well. Then when you're out there in the field, you're an ambassador of your school and also the knowledge that you've learned, so people are looking up to you. You put in your best, you look for opportunities. Nothing should be off table, as far as that profession is concerned. If you need to make a sacrifice at the initial stage, as long as you're in a position to help a patient or to, deliver that service, you go for it. There'll be time for, things will take their turn, but, remember that you went to school so that you become a resource person to somebody who is sick. So after graduation, you're looking for that opportunity. You never know where to land you, but wherever it lands you, you're ready to begin to put your knowledge to use. So, my advice would be, you're in a good path, you're already in a good profession. You just have to be committed and be hardworking, to be able to make it. And there are things, while we're talking about continuing education, it's getting better from the people that started initially. I know there are now, even most things are computerized now. So half of the job is done for you, as a matter of fact. When we're talking about, continuing education, there are some drug interactions that off my head I've forgotten, but the moment I'm dispensing a medication on that patient's profile, the computer is telling me, oh, these two things don't go together. All right, so there are easier ways to do the job now. All you need to do is just be committed and just be ready, to take on any challenge that comes your way. So pharmacy is still a good profession today, is a noble profession, and I'll address them to make the best out of it.
And Pearl, your dad and I are old school. So the advice we give the younger ones come from an old school perspective.
Yeah.
As a young person and a leader of your generation, which you are, what advice do you have for your contemporaries so that they can be the best they can be?
Yeah, I think, I guess my advice would be to get interested. I think the pharmacy world we talk about like either hospital or retail, but there's so many things that pharmacists and so many fields that pharmacists are in that could be interesting and could be something that they probably never thought that they could be in. So I think even some of our classmates that are just starting school, I always like to ask them, like, what do you like to do? Because I'm sure that there's a way a pharmacist is doing that too, you know? And so for me, as much as I like clinical, I'm also very into computers. I like Excel. I'm really good with data. And so I've been researching like how does pharmacist world and data interact? And you know, I've seen some companies, even like Google, who has Google Health, that I have kind of my eyes on. So I think my advice, especially for people, is to kind of branch out, to not be afraid to think of something new and try and make a pharmacist do it. You know, ultimately we are, you know, the advocates for patients. You know, a lot of the patients that I see now, even just a small interaction like, oh, how are you doing today, as they're picking up the prescriptions, they don't sometimes have this conversation with their doctors because it's usually come in and go out. So definitely finding the things that you love to do about pharmacy more than the title of it or the place that you work or the money aspect or the location, and just being passionate about the actual experience and getting interested in it, I think is what's going to make the profession more enjoyable. I think right now we're facing a lot of, especially in a lot of industries, especially in the medical one, there's a lot of pressure because people are getting sicker. The world is changing right now. So there's a lot of stress. But I think what keeps me as like a young person able to still wake up, and when me and my dad will go to work, we'll say, time to go save some lives, you know, to be active about it, is just understanding the meaning of what we're doing. You know, some things, sometimes I'll get phone calls from my parents' friends like, oh, like I just need some medication about this. And you'd be surprised how impactful we are as accessible health practitioners. So I think it's really important for us, everyone that's in the profession, whether you've been in it for 10 days or 10 years, to just remember why we do it and remember why we love it, and let our patients know that, you know? So yeah.
I couldn't say it any better. To both of you, I am really excited that we have this opportunity because I think it's fantastic to combine your knowledge, your enthusiasm, your selflessness, because it comes through how much you want to share your excitement about the profession and everything you've learned with those who are interested. So I'm really, really grateful. And I've thoroughly enjoyed this. I could go on, but I'm very conscious of the time. So I'm going to wind it up. And before I do, any final comments before we just wind it up?
This was so great to be a part of. That's my final comment. I look forward to seeing more interviews too, because I also would love to see just, you know, the different paths that pharmacists are taking. So thank you so much for inviting me to this and connecting me with just another aspect of my dad's life that I've heard some of the stories before, but getting to hear it as a fully packaged thing it was kind of nice.
The pleasure is all mine.
Yeah, but I mean, like I said, you know, this is initially I didn't know how it was going to go, but you know, I'm so thankful that I was able to be part of this. You know, it's just getting to talk and think back. You know, I never even thought about those days I was riding an iBus to go and do an interview. So just saying those things now is like kind of, oh man, God has brought me through a lot. You know, so I really enjoyed that, and I'm hoping that. This will impact on some of the younger ones to know that, like they said, the future is bright, just have to be optimistic, and just work for it. So thank you for putting this together. Like I said, I know it's not easy, it's taking your time out of this, but it's really appreciative. Thank you very much. I have enjoyed it.
Thank you so much. I too have thoroughly enjoyed it. And just as I thank you and close, I would like to obtain your commitments that as we share this with people, if someone has questions or need more information and they come to me, I will come back to you. Yeah. And if you have feedback when this is all put together or suggestions of other aspects of pharmacy that we can explore, we'll do whatever is helpful to anybody. So please stay connected. Yeah. And Pearl, having met you, you're never going to get rid of me. I will follow you. I will track you.
Yeah.
Your dad and I are already well connected, but now you are part of my network too.
Yeah.
Thank you to both of you. And I look forward to keeping in touch.
Thank you.